As always, we're joined by Dr. Syed Hussain of Trinity Health New England to talk about the big health topics of the world, one of which is a new study right out of Harvard that found that young adults between the ages of 18 to 25 are nearly twice as likely as teenagers to suffer from anxiety and depression. Curious to see what is up with that. Just seems to be a high rate of loneliness amongst this age group. Maybe he can shed some light on this. Doctor, good to see you again.
Likewise, Tim.
Glad to have you here. I know, it's a gross oversimplification that, hey, you think teenagers sometimes always are having problems just because it's that time in life, and yet here we go. Gen Zers seem to be having more problems. Do we know what's behind that?
Yeah, this is a survey, Tim, looking at the age group of 18 to 25. And it basically shows young adults in this age group may suffer from depression, anxiety, just a feeling of loneliness twice as high as teenagers, which is quite alarming. We know this is all in the backdrop of a brewing mental health crisis in this country that needs attention.
Yes.
But what the factors that may be contributing to this includes just the financial pressures young adults may feel, the pressure to perform and achieve certain standards in society that may start early on, and coupled all of this with social media, which doesn't seem to help.
Yeah, and so once again, easy to detail a lot of potential causes. Solutions, not quite as easy. Another topic we wanted to get to in the time we have this week, the Environmental Protection Agency just proposed an outright ban on a cancer-causing chemical commonly found in a lot of products. It's known as trichloroethylene, or TCE. You can see it in vehicle brake cleaners, furniture care, arts and crafts sprays, things like that. I believe the National Cancer Society said with enough exposure, it outright causes kidney cancer and is sort of associated with other cancers. What do we need to know about this?
Yeah, that's right, Tim. And also associated with other conditions, medical conditions as well. So one example I want to point out to viewers because of data is what happened in Camp Lejeune in North Carolina with Marines from 1975 for 10 years into the 80s. So those individuals, those Marines living at that camp were exposed to TCE 70 times higher than what is permissible in the water.
Right.
And there's a 70% higher risk of Marines who lived during that period of developing Parkinson's compared to veterans in other camps or other locations across the country, which again points out to all these toxic side effects from this chemical. So this is a step in the right direction.
Yeah, and usually when you're talking about cancer and other disease-causing agents, yeah, you're talking about how much is safe, not just binary, is it or is it not.
Right.
But in this case, they're trying for an outright ban, which we've seen before. What does it usually take for them to get to that point to say, we don't want any?
Yeah, there's a ramp-up period. So I believe there's a period of a year for manufacturing agents and companies in general to look at substitutes, so that, as you mentioned, it's used in the auto industry, in paints. It's used frequently, but ultimately the side effects are based on the fact that it can seep into water and ultimately make its way to drinking water.
And that's really where the problems come in. All right.
That's
Thank you so much. Dr. Syed Hussain from Trinity Health of New England joins us every week to talk about these topics that you all need to know about. Erica.